and CBCNews.ca. We are standing by to hear from the Prime Minister for his daily update on the federal response to the COVID-19 pandemic. After weeks of being shut down, some of the focus across this country has now turned to a gradual reopening of the Canadian economy and a loosening of some of those public health restrictions. Justin Trudeau spoke about that last night with provincial and territorial leaders. Lifting the pandemic restrictions, the Prime Minister has made clear will really be up to each province and territory, but they are now working on some national guidelines being created by both the provinces and the federal government. And the Prime Minister says all those plans will be, of course, phased in and put the safety of Canadians first. We're expecting to hear more about that in about 15 minutes' time. And we're also told that the Prime Minister will focus today on another critical part of the economy for several provinces, the fishing industry. Many of those seasons have been delayed by a number of weeks as the industry works on ways to practice physical distancing in very obviously restrained and restricted workplaces on boats and in processing plants too. So as we wait for the Prime Minister, I want to bring in my colleague, Catherine Cullen, who's going to help us with our coverage today. Catherine, let's start with that call last night between the Prime Minister and Premiers, because I know you were working on it last night as well. Does there seem to be at this stage sort of broad agreement that they can do this all together, or that the federal government has to take a leadership role? Give me your sense.
Ultimately, I think there is agreement that they are going to be putting forward. They're going to be working together on this set of guidelines. We expect them to come out sometime next week, one province suggesting perhaps even early next week. It's important to say, though, these are broad guidelines. We heard the Prime Minister talking publicly today about some of the kinds of things they might deal with. So, for instance, what is an acceptable level of testing if you are going to start reopening your economy? What needs to happen in terms of contact tracing? He talked about standards for workplace safety as more and more people continue to return to their workplaces. But what those reopenings look like, that will be, as you said, Rosemary, up to each individual province and territory. And we can already see, based on the two examples we've had, Saskatchewan and New Brunswick, that there are going to be significant differences from one province to another. Now, in part, obviously, that is going to be because the picture of the outbreak changes from province to province, but also because they're going to be looking at different measures. For instance, New Brunswick said yesterday that immediately people could form what's being called two household bubbles. So your household could choose one other household that you wanted to start interacting with. Of course, this has to be something that both households are in favor of. But that's a change we see right away. You compare that to what's happening in Saskatchewan, where they've said, OK, on May 4th, one of the first things that we want to allow to happen is medical services. Do you need to go to the dentist, the optometrist, physiotherapist? That's where we're going to start. Both provinces, though, also putting an emphasis on outdoor spaces because there's more possibility for physical distancing there. So we want to see what the federal government is going to be recommending. An interesting question in all of this, everyone has talked about the importance of doing this gradually, proceeding with caution. What happens when there are outbreaks? Questions about the severity of those outbreaks. What is the line at which provinces say, OK, we've got to pull things back? And this has relevance, obviously, not only for New Brunswick and Saskatchewan, but we know some major provinces, Ontario, Quebec, for instance, talking about laying out their plans in the coming weeks. So we'll be wanting to be watching for that as well.
Yeah, I know there's a lot of excitement in New Brunswick about the prospect of seeing one other family, even if you were restricted to one other family, and I can totally relate. It's interesting, too, that this is not just a national picture that is different across the country, but even inside provinces. I know our colleague Mike Crawley was talking about the lack of cases in Northern Ontario, or if Montreal is at the epicenter of much of the country and certainly of Quebec, how do you treat it differently inside a province? That, to me, seems even more challenging potentially.
Indeed, and if you look at what's happened in Quebec, for instance, where they've had to, for instance, in northern Quebec, ask for help from the armed forces, but then, of course, even within, say, the island of Montreal, let's talk about long-term care facilities, such an important part of this discussion. You have what's happening with the public at large, but also these outbreaks within these facilities that are proving to be the majority of the source of deaths in Canada, particularly in Ontario and Quebec. And that's part of the discussion about moving forward as well. The World Health Organization has set forward 6 standards that they would like communities, jurisdictions, countries to look at when they look at reopening. It has to do with, yes, testing, yes, contact tracing. But one of the things that they've said is that you can't have major outbreaks in places like long-term care facilities. So how does that fit into the picture of what communities decide to do when they decide whether or not to reopen? We should say, even though Ontario and Quebec are talking about putting forward their plans, in New Brunswick, for instance, they've already taken this first step. We don't know what the timeline and the rollout is going to be in terms of when they actually start moving on these measures.
And I should say the Ontario government announced today some new emergency orders as well. It will allow staff to be redeployed into long-term care homes, hospital staff or medical staff if they need it, along with the military, as you point out, deployed not only to Quebec, but now to 5 long-term care centres in Ontario. Okay, Catherine, I'm going to come back to you if that is all right. You can see now on the side of your screen the Prime Minister's home, Rideau Cottage, where he will come out and speak to us in about 10 minutes' time. You can also see on those trees behind the microphone there, the Nova Scotia tartan. They were put there yesterday, obviously, because of that virtual vigil that I know so many of you watched last night. But today, police in Nova Scotia do continue to investigate last weekend's deadly mass shooting. We have learned an awful lot since about the 22 victims and lots of new details about how those tragic events unfolded over the course of those 2 days as well. Shayna Luck joins us now from Dartmouth, outside Nova Scotia RCMP headquarters. Shayna, what can you tell us about the latest on the investigation?
Well, Rosemary, certainly a very complicated investigation, at least 16 different crime scenes, 22 victims. RCMP headquarters behind me, you can imagine they are working overtime in there today. And we know, as you said, a great deal more today than we did even just a few days ago. We know a lot about the timeline, where the shooter was, when he was there, and we know as well that this all began with a really terrifying incident of domestic violence. The very first person who was attacked was the shooter's longtime partner, his girlfriend. She was attacked, she was forcibly restrained, and we know that the attack, police have told us, was a significant one. However, she survived that. She was able to escape from him, and she fled into the woods around Portapique. She stayed there overnight for safety. She didn't emerge until the early hours of Sunday morning, and that's when RCMP found her. She became a key witness. She was the person who confirmed for them that he was traveling in a fake RCMP car with a fake RCMP uniform. She was the one who told them that information so that they could get it out to the public. But before that could happen, he was able to use those fake car and uniform to really get around the province and to kill a great many people. We're hearing that he killed people who he knew, but also that he pulled people over using that fake car, and he shot them. He murdered them right there on the side of the road. So some very grisly details coming out.
Yeah, those are all, it's very horrifying, obviously, but I know that there's a lot of focus, too, on trying to understand where the gunman got the car, got the decals, got the uniform, because obviously this is what gave him sort of an advantage, if you will, as he went through his 24 hours.
That's right. The RCMP have dwelt on what an advantage that was for the shooter to have that car and that uniform, so that he essentially did look like an officer. And we know a little bit more about how he was able to get that. The RCMP have told us that certainly RCMP cars can be bought at auction. They're commonly sold off, but they would be stripped of any RCMP identifying information before they were sold off. So it is possible that the shooter got an old car, but he was able to reconstruct the images that an RCMP, a true RCMP car would have. RCMP told us yesterday that they believe they have tracked down the shop where the shooter bought the light bar on top of the car. They also say that they are still looking for the printing shop where he would have got the decals to put those icons on the side of the vehicle, so that it really appeared to be an extremely realistic mock-up. So that's a big focus for the investigation going forward.
Okay, Shayna Luck, thank you for this. I appreciate it. That's Shayna Luck in Dartmouth, Nova Scotia this morning. I should say as well, in case you missed it, as it happens, Carol Off did a very compelling interview with the Commissioner of the RCMP, Brenda Lucki, in which Commissioner Lucki did say that if an emergency alert had been sent out to the residents of Nova Scotia earlier, one was never sent, in fact, if they had chosen to do that and to reveal that the suspect was in fact traveling in an RCMP car and uniform, that could have made a difference. That's up on our website if you want to go give it a listen. All right, let's track back to the story that we are here covering every day at around this time, and that's, of course, the government's response to COVID-19. Well, we talked to Kamal Khera a few weeks ago. She's the MP for Brampton West in Ontario. It was 1 month ago, actually, when she learned that she herself had COVID-19, and I'm happy to report she's doing better, and she joins us from Brampton, Ontario. Look at you. You look great. How are you doing, Kamal Khera?
Thank you, Rosie. Thanks for having me on the show. I'm happy to say I feel great. I've had full recovery. The journey, it was as expected. It wasn't easy, where I got all COVID symptoms and more, but I'm extremely fortunate because I know there's people that are going through extremely tough times right now, and I just want them to know we're thinking of them. But I remain, very, very extremely grateful for the incredible healthcare workers, especially our Peel Public Health, the nurses who checked up on me almost every day and truly got me through this whole experience.
That's good. And, it is important to talk to people who have survived this, too. A lot of the focus is, of course, on the deaths, as it should be. But we should say that about a third of cases in this country have been resolved. So people do get it. People do get better. You didn't have to go into hospital. You were just able to stay home and sort of care for yourself. Is that what you did?
That's right, Rosie. As I mentioned, when I came on your show almost a month ago when I was tested positive, it started off with mild-like symptoms. Then I had some good days, some bad days. Some days I couldn't just get out of bed at all. I had shivers, I had high fever, sore throat, cough, headaches, body aches. I also had this rare symptom of a viral rash all over my body that lasted a few days. I lost my sense of smell and a loss of taste, but I'm very fortunate that throughout the whole time I was supported by our public health nurses who checked up on me almost every single day. And I'm extremely thankful for their guidance and support in managing my symptoms and to be completely healthy once again.
And you yourself, right before this happened, wanted to lend a hand because you are a nurse yourself and you wanted to participate in doing some telehealth calls and helping people do that very check-in that ended up happening to you. Are you going to go through with that, or what are the plans there?
Certainly, Rosie. As I mentioned, when the RNAO's first call to action came out, that was a no-brainer for me to put my hand up and sign up. I am on that list, and now that I'm fully recovered, I look forward to contributing at the front lines, balancing my time between being a member of parliament as a PRLSEC and now as well as a nurse.
Of course, yeah. I imagine it was hard to do some of the constituency work over that period, given how ill you were on certain days.
No, certainly. It was definitely tough, but I'm very thankful for our team and the work that we have been doing. One thing also, I think what I realize is now virtually working from home is the fact that we're actually very productive and the fact that we can get to a lot more constituents as well. Obviously, I do miss seeing my constituents, face to face, but I think it's really great to see because of technology that I'm able to hold town halls, connect with my youth council, and do the important work that, we'll be eventually doing with virtual parliament as well. So I'm very, very happy for that. And I think I'll say, throughout the whole process, Rosie, that, I've realized that the whole process works, being from, listening to the recommendations from our public health official to being supported by our public health nurses every step of the way. So, I'll just continue to encourage, obviously, Canadians to continue to follow the advice of our public health, continue to practice social distancing, and to please continue to stay at home.
Yeah, and that's an important message because we are, of course, nearing, this is now more than a month of this. People are, the weather is better. People are starting to get fatigued by it. But as you say, everyone continues to say it's important to still follow the rules as they are now and really limit your exposure to other people as much as possible.
Certainly, and that's the advice that I'm continuing to, talking to my constituents. And I think throughout my whole journey, and I posted a video about some of, the journey that I've been through, my COVID experience, and it just goes to show, it doesn't matter if you're young or if you are, a different gender, or you tend to think that it's only affecting our elderlies, but I'm having gone through the experience, I can tell you that it was extremely hard for me. I've never gone through something like this, and that's why it's so important for us to continue, to make sure that we're staying at home, practicing physical distancing, and only going out when we absolutely essentially need to. We owe it to our healthcare workers. We owe it to our essential workers that are working day in and day out, and making sure that we stay home at safe. And we need to do our part by staying at home. So then, so we can all come out of this stronger together.
Okay, Kamal Khera, good to see you up and feeling better. I know lots of Canadians going through this right now, but good to see one of our parliamentarians as well able to send that message from personal experience. Thank you for making the time again. Appreciate it.
Thank you, Rosie. Take care.
Okay, that's Kamal Khera, the MP for Brampton West. And again, there are about a third of cases recovered in this country. So that is also part of the story, that you can get COVID-19, not necessarily be hospitalized, and recover at home. Of course, the number of deaths in Canada now exceeds 2,300. The number of cases tops 43,000. But we do know that not everyone is being tested. Testing a key part to understanding all of this. Here is the Prime Minister of Canada speaking now. We'll bring you there live.
Started today. I wanted to thank the organizers of yesterday's vigil for the victims of the Nova Scotia shooting. The pandemic may have prevented us from gathering in person, but we still found a way to come together to celebrate the lives of the victims and support their families. It was an extremely moving tribute, and was just yet another example of how Canadians are there for each other in difficult times. Once again, my thoughts and the thoughts of all Canadians are with the families and loved ones of the victims. This week, our government announced more targeted support for Canadians who are going through an especially hard time because of COVID-19. With the Canada Emergency Community Support Fund, we're giving more resources to charities and nonprofits so that they can continue their important work. We also unveiled our $9 billion plan to help students and recent grads get through the next few months. Because of COVID-19, there aren't as many jobs for students as last year, and without a job, it can be hard to pay for tuition or the day-to-day basics. So we launched the Canada Emergency Student Benefit, which gives students at least $1,250 a month from May to August. At the same time, we're creating 76,000 jobs for young people in sectors that need an extra hand right now or on the front line of the pandemic. And if students prefer to volunteer and help in the fight against COVID-19, they'll be eligible for a $1,000 to $5,000 grant through the new Canada Student Service Grant.
For small businesses, we announced yesterday that we had reached agreements with all the provinces and territories to lower by 75% their rent for the months of April, May, and June. I also want to take this opportunity to remind employers of all sizes that they can apply starting Monday to receive the emergency wage subsidy. In the meantime, you can go to the site of the Canada Revenue Agency to calculate what the subsidy will cover. Our government is providing help to meet immediate and urgent needs of both workers and businesses. At the same time, we are also thinking of what to expect in the coming months. We are providing more funding to medical research on COVID-19 and the development of a vaccine. This week, we put in place the COVID-19 Immunity Task Force, whose mission will be to trace infection and get a better understanding of how we can become immunized against the virus.
Our objectives as a government have been clear. Help those who need it most. Protect jobs. Support the small businesses that make our communities a better place to call home, and lay the groundwork for our economy to come roaring back once this crisis is over. In the past few weeks, our government introduced a series of measures to do just that, but we know there are more people to help, more work to be done. So today, we're announcing $62.5 million to support fish and seafood processors through this crisis. As we fight COVID-19, people who work in fish and seafood processing plants across the country are playing a crucial role when it comes to getting food to our tables. This funding will help ensure that they can safely continue their important work. We're giving more money to processors so that they can purchase personal protective equipment for workers, adapt to health protocols, and support other social distancing measures. For example, fish processing plants could buy new equipment like freezers or storage space so that their product, food for Canadians, can stay good while they respond to a changing market. With this announcement, we're giving fish and seafood processors more resources to adapt to the many challenges brought on by the pandemic and, above all, keep workers safe. Our fish sector is interconnected, so these investments will also have a positive impact on fish harvesters. On that note, I want to take a moment to recognize the tremendous work that is being done by every person who makes Canada's food system possible, including our food producers and fish harvesters. You keep our grocery stores stocked and our families fed. I know that the past few weeks have been really tough on you too, whether it be financially or emotionally. I want to thank you all for everything you do for us. You're providing an essential service to the country. We know that you have specific needs and asks right now, and we are actively exploring additional ways to support you as we move forward.
Today, we are announcing an investment of $62.5 million to support fish and seafood processors in this crisis. People working in that area feed our families every day. We are investing to allow them to continue their important work in safety. This is money that processors will be able to use to buy personal protective equipment for their workers, adapt their health protocols, and support other measures such as social distancing. Fish processing plants will be able to use this money to buy refrigerators or storage space to store their products in order to sell them later. Thanks to today's announcement, fish and seafood processors will have the necessary resources to face the challenges of this pandemic and protect the health of their workers. Because our seafood processing sectors are closely tied, these investments will also be able to help fishers. And in fact, I want to take a moment to talk about the incredible work being done by all people who work in the food processing industry. You fill the shelves of our grocery stores with fresh products, and I know that the recent weeks have been very difficult for you, financially or emotionally. So thank you for everything you're doing for us. We know that you have special demands and needs, and we will continue to look at different ways of helping you. As I mentioned yesterday, I had a discussion with the premiers of the provinces and territories, and we talked about gradually reopening the economy. We are working with public health officers to set out the principles and standards that will serve us all. The economy and the realities of each province are unique, so the timing and specific measures will be different from one province to another. That said, there is an important coordination work that must be done at the national level to avoid confusion. We are now establishing a plan based on science, data, and experts' advice that reflects our common ambition to lift this country out of this crisis. The next phase will be crucial. If we do not introduce the right measures, we could lose all the progress we've made thus far. Our discussions are continuing, and we will continue to work together to ensure the safety of all Canadians.
Yesterday, I had a call with the First Ministers, and we talked about putting together a joint statement outlining what needs to be done to reopen the economy. We're working together with Canada's chief medical officers to establish principles and guidelines for us all. We have to be mindful that the economy and the realities of each province and territory are unique, so the timing and specific measures will be different across jurisdictions. We need a coordinated approach nationally to avoid any confusion amongst Canadians. We're working together on a plan based on science, data, and expert advice that lays out our common ambition to see our country through this. If we don't get the next phase right, we risk losing all the progress we've made so far. These conversations are ongoing, and we will keep working together for all Canadians. Tomorrow, there won't be any press conferences either by doctors or myself, so I want to close this morning to talking directly to young Canadians, as I do every weekend. To all the kids watching out there, you're doing great. Keep helping out around the house, try to keep up with your schoolwork, and above all, stay positive. This is a tough time, but we're going to get through this together. And to young people out there, many of you are students who need extra help, and we're here for you. This week, we announced a series of measures to support you during this crisis. But we need your help, too. This is a moment in our country's history that we will look back on and ask each of ourselves what we did for our community, for our country. What did we do to serve our country, to help the world? And as you look at what you can do this summer, please remember that there are seniors who need your help. There are frontline workers, including in our medical professions, who could use a helping hand. And there are agricultural farmers and producers who'd love to see you step up to help feed Canadians. Look at how you can use your energy, your drive, your vision for making the world a better place, and make it so. How we get through this as a country depends on each of us, the choices we make, the actions we take. So this weekend, stay home, keep washing your hands, and if you need to go out for groceries, keep at least 2 meters apart from each other. And think about what you can do in the fight against COVID-19 to support our frontline workers, to help your community. I know that we will help each other to get through this, because that's just who we are as Canadians. Merci beaucoup. Have a great weekend.
Thank you, Prime Minister. We'll now go to the phone lines for questions. One question, one follow-up. Operator.
Thank you. Merci. Première question, Mélanie Marquis, La Presse. À vous.
Good morning, Mr. Trudeau. Yesterday, your remarks about helping out in seniors' homes. Now, we haven't seen the federal support working that well in Ontario and Quebec. And in fact, we've heard people saying that this sector has been underfinanced for years. Will you increase health transfers to avoid this situation recurring during the second or third waves of COVID-19? Thank you, Mélanie. Well, first of all, I've always been very clear that I have no intention of interfering in provincial areas of jurisdiction. However, people are asking real questions right across the country about how we support our seniors, about how we look after our most vulnerable Canadians. And I think these are questions we have to look at seriously. But in the months and the years to come, after we've come through this pandemic and this crisis, we have a responsibility to reflect on how we can do things better, to help those who built this country, help them during the last years of their lives. So, of course, we will have discussions on health transfers. We've already transferred $500 million in direct funding to the provinces for their health system. And we will also be looking at how we can work together as a country to ensure that the current system is adequate to help all Canadians.
I've been very clear that I have no intention of seeing the federal government take over or get involved in provincial areas of jurisdiction. But I think Canadians are asking themselves very, very important questions right across the country about how we care for our elders, how we support the most vulnerable in society. We have to answer those questions. We have to work very hard to come up with better answers than we've had until this point. And that, yes, means talking about transfers to the provinces. We sent $500 million in a health transfer to the provinces at the beginning of this crisis. But there is always more to do. So over the coming weeks, months, years, including beyond this COVID crisis. We need to do a better job of supporting our elders, supporting those who built this country. And that's what we're going to do.
Follow up, Mélanie? Yes, thank you. With respect to the student benefit, in Quebec, they're not terribly happy about that because they already have a program in place. Did you discuss this with Premier Legault, and would you be prepared to make adjustments to your program and the bill you will be introducing? Our students need support now. Summer jobs on which they were counting have pretty much disappeared, and they're looking at ways to be able to pay their groceries and rent. I know that young people right across the country want to help and that they want to be there to help. But we also have to be there for them. And that's why direct support for students in these difficult times is not only for them, it's for their future. And we need to ensure that our students can receive the necessary support this summer and opportunities to gain work experience that will be helpful in the rest of their career. But we also need to ensure that they can fund their studies once we're in September. So we're very pleased to work with other parties and with the provinces to enhance the aid being provided in different areas, including students, and we will work with them.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse. À vous.
Good morning, Mr. Trudeau. Just to come back to the long-term care homes, when you say that you are prepared to bring those facilities back into the federal jurisdiction, were you serious? No, I have no intention of interfering in provincial areas of jurisdiction. But of course, we will be having discussions with the provinces as to how we can help to rectify the situation in the short term and also provide adequate funding for our systems across the country. But the federal government has no intention of interfering in provincial responsibilities. Follow up? At the same time, you said you will have to have this discussion and that maybe it could be brought under the Canada Health Act. But what I'd like to know is, after your discussion yesterday with the provinces, what did you agree on concretely in terms of reopening the economy? And were you not a little slow in establishing these guidelines, since the provinces are already starting to reopen their economies? Well, we have been talking to the provinces, and we have agreed to base the recommendations and guidelines on science and experts' advice, as well as increased testing and contact tracing. So we basically agree on the principles and approaches and practices that are necessary. But at every step, we also realize that the provinces and territories will be taking different approaches. So we wanted to create a system or a set of guidelines that the provinces could support, so that all Canadians across the country will see that we are introducing measures that are focused on science and a common approach across the country to keep everyone safe and allow the economy to gradually reopen while being vigilant.
Thank you. Next question, operator.
Thank you. Merci. Next question, Justin Ling, freelance. Line open.
Good morning, Prime Minister. I want to ask you about a report that came out yesterday from the correctional investigator. He wrote that prisons across the country facing COVID-19 were throwing inmates who were symptomatic or who had tested positive for COVID-19 in what they were calling medical isolation, but what he describes basically as solitary confinement, and said basically it was not justifiable or tolerable. I'm wondering if you're comfortable with federal prisons throwing inmates in what is essentially solitary confinement, in the midst of a pandemic?
We have taken a number of strong measures in corrections facilities to protect inmates and staff members from the spread of COVID-19. I am aware of the report put out yesterday, and we are following up on the details.
Follow up, Justin?
Yeah, frankly, Prime Minister, it's been frustrating asking you about this. Your public safety minister is, of course, the one responsible for Canada's prisons, but he hasn't really been seen in the past month, aside from a brief press conference on a different matter. Where is Public Safety Minister Bill Blair?
Minister Blair is working extremely hard on keeping Canadians safe, whether it is dealing with the Nova Scotia tragedy, as you all know, or working with the Border Services Agency to make sure that our border measures are strong in place. He's been working with provinces on preparation for floods and forest fires as they come up this season. He's also continuing to work on the strong gun control measures that we've had to do. We have been incredibly fortunate to have Minister Blair work on the corrections file as well as all the other files that keep Canadians safe, and I'm very proud to have him by my side.
Thank you. Next question, operator.
Thank you. Merci. Next question, Teresa Wright, Canadian Press. Line open.
Good morning, Prime Minister. The World Health Organization has issued a statement saying there's no evidence people who recover from COVID-19 are protected from a second infection, and that was in response to countries discussing the possibility of issuing immunity passports to people who have recovered. How wise is it to be discussing plans to lift restrictions with provinces if it's possible that people could get sick more than once from COVID-19?
In the approach that we're taking very carefully around the provinces and across the country on looking at reopening, I don't believe that there are any of the plans that hinge on certain people or individuals being immune or having immune to COVID-19. The focus we have is on continuing to prevent spread through social distancing measures, through PPE in workplaces, through various measures of protecting Canadians as we move forward. There is still an awful lot of science being done on the idea of immunity on protections, which is why we've invested significant amounts of money in a new Canada immunity task force that will be examining these issues. But it is very clear that the science is not decided on whether or not having had COVID once prevents you from getting it again. We know it is something that we need to get clearer answers to, and until we have those clear answers, we need to assume that and err on the side of more caution. Okay.
There is no scientific evidence at this time that if you have caught COVID-19 once, you are protected from catching it again. So all the plans being established by the provinces are based on protecting Canadians and preventing further spread of COVID-19, and not as immunity as something that can be considered in the coming months. There's still a great deal of work to be done on that, and that's why we are investing in a task force, an immunity task force in Canada, with extraordinary experts and scientists to expand our knowledge of this disease.
What lessons do you take for Canada from the disunity that we're seeing in the COVID-19 response in the United States? And what worries do you have about how we might ultimately be affected?
I think, first of all, Canadians can, take great comfort in the fact that all of our orders of government have been working together in a very strong and aligned way. That we have, as a country, focused on listening to experts and scientists as we move forward, as we make decisions on how to keep Canadians safe. We have seen extraordinary medical health professionals and public public health officials across the country, sharing with citizens in their provinces how they can keep safe. And we have a great team at the national level that is helping coordinate and inform the decisions taken across the country. As we move forward with a framework and guidelines that will impact on the direct decisions taken by the provinces that the provinces themselves are working with us to generate, we've seen that this unity that Canada has, despite tremendous variance in impact of the virus, in nature of the economies and the kind of situations people live in, has been deeply reassuring to Canadians, and we will continue focusing on that. And as part of the way forward, we will continue to make sure that Canada and Canadians are protected from external sources of the virus, whether that's keeping up international border measures or moving forward on specific measures around quarantine for anyone who arrives in this country. These are the things that we're going to continue to do.
Bonjour, Monsieur Trudeau. Louis Blouin de Radio-Canada.
Il y a beaucoup de gens dans la communauté. There are a lot of people in the business community who are concerned that there isn't enough individual PPE because the provinces are starting to reopen. The businesses will do so as well. Are you not concerned that there will be enough equipment available? Do you think our in domestic production and what's coming in are enough? Well, one of the criteria about reopening the economy and businesses will be the availability of individual protective equipment so that people can work safely. And we know that the demand will continue to increase across the country. We will be moving forward gradually because, of course, we must have enough equipment for the provinces to protect workers, not just healthcare workers. So that's why, both in terms of our domestic production and our imports from other countries, we are increasing our capacity significantly. But of course, as long as we don't have enough PPE, we will not be reopening certain industries. Do you think that the current supplies are enough now that the provinces have talked about their plans? And what about people working in salons? Will they have to wear masks? Well, I don't think we should be reopening any sector of the economy until we have enough material to protect Canadians and ensure that we are stopping the spread of COVID-19.
I don't think we should be talking about reopening any parts of the economy if we do not have a strong plan to protect people working there and prevent the spread of COVID-19.
Prime Minister, Rachel Haynes from CTV National News. Yesterday, Doug Ford appealed to you directly in his press conference saying, if you're listening, they need help. In your call last night, what specific offers did you give to Ontario when it comes to the long-term care home crisis that they're facing right now?
We've put forward measures that have allocated billions of dollars to go to the provinces to support on top-ups for essential workers, particularly in long-term care facilities, and we look to have more announcements on that soon. But we've also responded to very direct requests by the provinces to send in military support. Obviously, that can't be more than a short-term answer, but we will be there to help Canadians who are going through extraordinarily difficult times. The situation in our long-term care facilities in different parts of this country is absolutely unacceptable, and all of us as Canadians need to do whatever we can to support our elders.
The situation in seniors' homes and long-term care facilities is unacceptable. And as Canadians, we must be there for each other. And we have offered money to the provinces to provide wage top-ups to workers in that sector. And we have given positive responses to requests is for the military to go in to help control the situation. So we will be there to help as much as possible, because that is what Canadians expect.
In your answer just now to my colleague, you said that Canada won't reopen its economy if we don't have enough PPE and enough masks, but we know right now that we don't have that. We just had to return some masks that came from China because they are not up to standards. We also know that there is this crisis that's going on in long-term care homes. Is it too early to even have these conversations about reopening the economy when there are still so many issues that we're dealing with right now?
I think there are really important conversations to be had in advance of opening up our economies. As we say, we have to be very, very careful and very gradual about it and ensure that we have the measures in place to control and prevent any further spread of COVID-19. Adequate PPE supplies will be a part of that, but I can assure you that we are very much on that, whether it's the plane loads of PPE supplies that will be coming in almost every single day next week, or the domestic production capacity, which is ramping up rapidly and will be ready to support Canadians as we move forward on steps towards reopening. These are the things that we need to make sure we're getting right, so as to ensure that all the sacrifices we've made over the past weeks won't be for nothing. Okay. We know
that we have to take a gradual and progressive approach and be very careful about reopening the economy in terms of the economy as a whole or certain economic sectors. And therefore, we need to have measures in place to protect workers and prevent the spread of COVID-19. And that's precisely why we will continue to receive more and more PPE. We will be receiving plane loads full of equipment in the coming days and weeks, and we will also be looking forward to domestic production of those goods that will be online very soon. All of that will be important as part of our plan to reopen the economy gradually.
Ashley Burke, CBC News. You said that the science hasn't decided yet on whether or not someone can become immune to COVID-19 if they already have caught it. You said Canada's studying this, but what other concerns do you have about immunity passports or certificates that might be needed down the line to prove that you are immune to COVID-19 at mass gatherings or sporting events, even to attend work when the economy eventually does reopen?
I think any such discussions or decisions need to be based on very strong and very clear scientific evidence. That's why our scientists are looking very, very carefully, as are people around the world, at what kind of immunity the presence of antibodies could deliver to Canadians, to people who've already been affected, and what impacts that has. We're not there yet on being able to make a pronouncement on that, so all the other elements are not discussions to be had now.
The European Union is planning a major funding event for the World Health Organization at the beginning of May. Will Canada be part of that event? And would you consider attaching some sort of conditions to that funding, like a review of the WHO's handling of this pandemic?
Canada will always be there to support science and the work done internationally on keeping our planet and our citizens safe. This is something that we are looking to participate in. I think, like many countries, there are questions around how to ensure that we learn from this situation and we get better at dealing with these things with a level of transparency and rigor that I think citizens expect.
Hi, Prime Minister. Crystal Logue with Global News. Can you speak a bit more about what the federal government responsibility on rulemaking falls when it comes to reopening the economy, and where it will be up to the provincial government so far as responsibility in rulemaking and on the reopenings of the economy?
Our Constitution lays out very clear areas of federal, of provincial, of municipal, by extension, responsibilities. And of course, the provinces will have a lead role in determining how their economies will reopen. But that's why we've been working with the provinces, who are very varied in their realities, in what they are being challenged with, to establish a base level of criteria criteria, a checklist, a set of guidelines that will ensure that right across the country, the decisions being made by each province will be based around a shared understanding of the science and the steps necessary towards reopening. But of course, every province has its responsibility and its decisions to make on how it reopens.
And I understand that some premiers last night indicated that a renewed infrastructure program will be vital to restarting the economy. With construction season upon us, can you tell us about the federal plans in this regard and whether or not the federal government will allow municipalities in particular to contribute a small percentage of cost to any municipality project?
We understand the importance of getting our economy going again as quickly as possible, but that as quickly as possible depends very much on ensuring that we are arresting the spread of COVID-19 and in an ability to prevent further spread. That is why, yes, we are in discussions with the provinces around infrastructure investments to benefit from this construction season, but we need to make sure we're doing that safely and responsibly, and that is also part of the conversations we're having with the provinces.
We recognize that the economic recovery can include the construction season, but we must ensure that we do things in such a way as not to make workers vulnerable or end up further spreading this virus. So we are currently in discussions with the provinces about infrastructure measures that could help, but the concern of every province is primarily the protection of the citizens of their province. Thank you very much, everyone.
All right, that is the Prime Minister of Canada wrapping up his daily briefing just outside his home at Rideau Cottage. His primary announcement today about the fishing processing industry, and we'll talk a bit more about that in a moment, but let me bring in the CBC's Catherine Cullen to talk about all the other bits and pieces, because a lot of it was focused, obviously, Catherine, on how to reopen the economy, when to reopen the economy, and an interesting portion of that I'm not sure I had been thinking about was how much personal protective equipment do you need for companies in order to be able to do that, and that obviously is an ongoing concern too.
Yeah, I mean, there was so much there to talk about, Rosemary, and the Prime Minister did say at one point that if there is not enough personal protective equipment for some industries, they just shouldn't reopen, which of course raises the question, which industries would this come down to? How would the distribution happen? We know about the incredible efforts, and the Prime Minister acknowledged them there to get enough personal protective equipment for people, frontline workers, people who are in hospitals and long-term care facilities. Our colleague David Cochran has reported on the supply chain that's being built, essentially a bridge, an air bridge of supplies in China, trying to get that equipment to Canada. We know about domestic efforts to ramp up production here in this country, but obviously the demand would increase greatly as we would hope to see more and more businesses start to reopen and come back online as provinces continue along with their reopening. So that's obviously going to be a significant source of discussion. There were a couple of things, too, that the Prime Minister touched on that I thought were really interesting. We should maybe talk about the context around. I was quite interested when he was asked the first time about this question of immunity passports. This is something that Chile, in particular, is exploring. This idea that if you've had the virus, if you've recovered from COVID-19, that you would get a sort of a card that would allow you to go back to work and participate in society, let's say, as normal, although I think we all understand that normal has changed greatly. The World Health Organization came out yesterday and said it doesn't support that. The science is not there. The Prime Minister said he does not believe that there are any plans in Canada that hinge on people being immune to COVID-19. And I would just flag that the Premier of Quebec has, in fact, raised quite a lot of interest and in some cases concern in recent days when he has talked about the prospect of herd immunity and that being part of the plan in gradually bringing school children back in that province, that they, because they seem to be at lower risk, I should say, of falling seriously ill from exposure to this virus, that over time, gradually by bringing children back, you would build a sort of herd immunity in society that has provoked a lot of discussion. But obviously, it's interesting to see the interplay of that idea with what the WHO is saying, with what the Prime Minister is saying, that the science simply is not there. We do not know that just because you have those antibodies that say that you've had the disease, that you are in fact immune if you are to encounter the disease again. Perhaps you could be reinfected.
Yeah, that was interesting because I think he's right. The science isn't there yet. So to predicate a policy decision based on something that doesn't support it would be strange. I also want to just get you to weigh in on the long-term care question, because there was some bristling in Quebec, particularly when the Prime Minister suggested yesterday maybe this is something that needs to come under the Canada Health Act. I'm not sure that he said I'm pushing that idea away entirely. It sounded to me like that is still a conversation he wants to have.
Certainly sounded like he was trying to diminish some of the bristling, I guess we could say. Yesterday, when François Legault, the Premier of Quebec, was asked about the possibility of greater federal intervention when it comes to long-term care facilities, he basically said, back off. He said, we can manage our own healthcare network. What we need from the federal government is more money. And we actually heard, frankly, a very old conversation about healthcare transfers, where he talked about the fact that these days 23% of Quebec's healthcare spending is paid for by the federal government, that back in the early days it was a 50-50 split. He said, we want to talk about more money. And it was interesting to hear the Prime Minister today say, yes, we are ready to have those discussions, but those discussions are for later. One of the first questions was actually, well, what about a second or third wave? Do you not need to get that additional healthcare spending out the door to happen to help in cases such as that? And the Prime Minister really seemed to be saying, listen, we have to deal with the immediate situation now. We are willing to have those discussions. They will happen later. I do just want to quickly mention Rosie as well. He talked about billions of dollars being allocated for top-ups for essential workers. We've been hearing this discussion for a long time. The money is allocated. It is not out the door. The conversations with the provinces on that seem to continue, and we know that that is a particularly urgent issue, trying to get more money to long-term care workers so that they will stay in their incredibly difficult and demanding jobs.
Okay, excellent, Catherine. I'll come back to you if you don't mind. Thank you for that. But now let's get some more reaction to the Prime Minister's announcement of that $62.5 million to support fish and seafood processors. Keith Sullivan is the president of the Fish, Food and Allied Workers. It's a union that represents more than 15,000 women and men in Newfoundland and Labrador, and he joins us from Bay Bulls. Good to see you, Keith. Maybe good to see Keith. Keith, can you hear me? Okay, he can't hear me, so we'll try and get that sorted. But it was $62.5 million the Prime Minister announced, but it was for the processing part of the industry. And he did say very clearly in his announcement that we understand you have more specific needs and you want additional ways to get some help. And we will discuss those moving forward. I'm not sure if that pertains to the actual boats that the fishermen and women would go on to go out and do their work, because of course those are very restricted in terms of space, whether they're big or large. But it certainly seems as though the processing plants, they're even looking to give them money, for instance, to freeze goods in case the supply chain isn't there. We know that almost every fishing season has been delayed by 2 weeks or more in many places in the Atlantic provinces. So that's obviously putting a severe strain on the economy out there. While we wait for the federal briefing with federal cabinet ministers and public health officials that starts at noon Eastern, I'll go back to the CBC's Catherine Cullen because that's where I go when my guest can't hear me on Skype.
Let's talk a little bit more about seafood then, Rosemary, and the distinctions that the Prime Minister was making when he made the announcement. He did say indeed that it is for, as you say, seafood processors, and he talked about the seafood harvesting industry as well. And he did say that he hopes that this money, the $62.5 million, will help the harvesters, but he also acknowledged that there need to be more conversations around how to help them. I thought it was interesting that he really did make the point about this money going to help the Canadian, the domestic food supply. Of course, we know that a lot of seafood is exported as well, and that one of the concerns that we've been hearing from the industry is about the collapse of the markets. It's part of the reason that we've seen them ask for the season to be pushed back, is in hopes that some of that market returns, because of course, yes, there are questions about actually processing the food, about actually going out and getting the fish. It's been said many times, but I think it's self-evident to all of us, even if we aren't involved in fish harvesting, that there's probably not a lot of space on those boats for physical distancing. Read that one great quote that said they sleep so close to each other on some of these boats that they share the same dream. So you can imagine how challenging that would be. But the Prime Minister acknowledging certainly there's more work that needs to happen for the people actually going out on the boats in terms of the supports that they might see.
And we do expect the Minister responsible, Bernadette Jordan, to be at this briefing at noon, so she can perhaps answer some further questions about where else the support might be needed, as you pointed out. I'll just end on maybe this point. First of all, the news that the Prime Minister is not going to hold a briefing tomorrow, which is, one of his days off. He hasn't had very many, and doctors won't either. But as he went through sort of the list of things that the government has done in a week, it is a sort of a staggering number of policy measures and amount of money at a time when you keep thinking, well, we must have done all the things that are possible, and no, there are still gaps to fill. But I'll end with what his message was too, and that was for particularly students who did get a substantial amount of aid this week, $1,250 per month. It was to think about other ways that they could help Canadians and get credit and some additional funds for that. And I think that that's a good place to end, because it is something that they should start thinking about. I've only got about 30 seconds, but...
I'll just note quickly, and maybe we can talk about it later, that it's actually, though, proven to be a bit of a point of friction in Quebec in particular, where some of the agricultural industry folks there are wondering if this is going to draw people away from their sector, students who might have been willing to work with them. But you make the point, they are trying to get students out of their homes and helping volunteer, picking up jobs, some of these greatly needed frontline jobs as well.
Okay, Catherine Cullen, thank you for your help with all of our coverage. Appreciate it. And so you've just heard the Prime Minister, no briefing tomorrow. I'm sure he'll be back at it on Monday. But today's announcement, as we said, focused on the fish and seafood processing plants and that part of the industry, more potential help to come for other parts of that industry. And we know that the Prime Minister and public health officials continuing to say things are going well, but we have to keep up the things that we're doing in terms of physical distancing. We'll say goodbye now to CBC Television. You can keep watching on CBC News Network. Hello again, I'm Rosemary Barton. Thanks for joining us on CBC News Network, streaming wherever you might be in the world on the CBC News app and CBCNews.ca. We are waiting to hear from federal cabinet ministers and health officials for their daily update on the COVID-19 pandemic. The latest data shows that the disease is still spreading, with more than 2,000 new confirmed cases. That puts the national total at nearly 44,000. Of course, that number very much in flux, because the more testing that is done, we're up to about 20,000 tests per day, the more we get a clear picture on where the pandemic is in this country. The focus today will be, of course, continuing to combat the virus in what has become really the epicenters of the outbreak in Canada's long-term care homes. Ontario, now the second province to receive some military support after Quebec in containing those outbreaks in those facilities. And again, Quebec is still waiting for more military support as well. It's asked for additional support. But today, the focus of the Prime Minister's briefing, and again, we'll hear more about it at noon, was an announcement of $62.5 million to support fish and seafood processors. And I'm going to try this one more time. Keith Sullivan is the president of the Fish, Food and Allied Workers. Keith, good to see you. Thanks for making the time.
Yes, good day, Rosie.
Good. So tell me what you make of this announcement, $62.5 million, but it is very specifically for the processing plants. What do you make of that?
Yeah, so first of all, harvesters from all Atlantic Canada right across to British Columbia have been looking for some relief since this pandemic began. So today, obviously, as a part of that, it's encouraging. First thing, we know that those in the processing sector and in plants have some serious concerns about their health and safety. So will be important that this money is actually spent to make sure that the proper PPE is there and that workers are protected, because there is serious concerns about being able to distance in these facilities.
For sure, and we've seen outbreaks, of course, in beef processing plants, chicken processing plants. So this is an issue because of the restricted sort of working conditions. However, there didn't seem to be anything here for the people going out on the boats themselves. The Prime Minister said, "We know you've got more concerns. We're willing to do more." Is there any way to make that work, though, at all, Keith? If you're on a small boat or a big boat, these are tight quarters. It seems very challenging to make sure people have enough space.
Yes, so the safety does remain the number one concern for everyone in the industry. And as a result of that, harvesters in Newfoundland and Labrador and other places have delayed major seasons. For example, we fish snow crab, lobster, shrimp, millions of pounds of these shellfish. And as a result of the delays and of market problems related to COVID-19, we're going to have severe difficulties. There's going to be instances where people just can't make ends meet. And that's why we've asked for specific things just for harvesters. And that was what the Prime Minister's announcement missed today. And we hope there's more to come.
Well, it sounds like there is. So what more would you need then for the harvesters in particular?
Well, specifically, you can't harvest these species when you want. There is a season. So we've asked to extend employment insurance benefits for harvesters because they may not be able to harvest this year, and it's not something you can pick up later in the year. In other instances, fish harvesters have fell through the cracks of some of the other programs. For example, individual harvesters are not eligible for the wage subsidy or loans as other businesses are. So that's an important thing to address for harvesters. And a more obvious one would be just waiving fees that individual harvesters pay to federal government, which can be significant, thousands of dollars, and in some cases, tens of thousands of dollars.
So just to go back to the issue of personal safety, public health safety for harvesters, is there an attempt to try and get personal protective equipment that might make it possible for some people to go out, maybe in a limited capacity?
This work has been constant, looking at the proper procedures and best practices to operate in a COVID-19 environment, looking at what PPE is reasonable. But we know on these vessels it is difficult and in a lot of cases impossible to separate. So ensuring that you prevent COVID from getting on the vessel is important. And for example, in this part of Canada, we've been fortunate to see no new cases, for example, in 7 days. So I think it really depends on what the greater population is doing as well. But harvesters, we're certainly happy that those in the fishing industry were cautious and wanted to wait and make sure that they were safe before they start a big industry like the fishery.
Okay. Keith Sullivan, good to get that perspective today. Appreciate it. You are in Bay Bulls, Newfoundland. Thank you for your time. Appreciate it, sir.
Thank you, Rosie.
Okay, so that is some reaction immediately to the federal government's decision or announcement today about the fish and seafood processing. As you heard, though, lots more hoped for by harvesters themselves in the Atlantic provinces primarily, but wherever they may be. We are standing by, of course, to bring you our daily briefing by cabinet ministers. We are expecting to see the minister responsible of fisheries and oceans there, Bernadette Jordan, as well as public health officials. Let me bring back my colleague, Catherine Cullen, now, who's helping our coverage here today. I think we are also going to hear from Mark Miller today, he does sort of a weekly briefing on the situation for Indigenous peoples in this country. And there has been a real push as well to make sure that they have enough PPE in those communities that are already, of course, really challenged by perhaps the remoteness of the community or the fly in, fly out. Yeah, yes. All those things, or even lack of some basic health care as well. So there has been a push to do that. Fortunately, the number of cases has been not a huge number at this stage, although they have seen a number of deaths.
Yeah, and so again, we will expect to hear that update from him today, giving us a bit of a better picture of what's happening in those communities. But obviously, it's one of the instances when we look at particularly vulnerable communities across the country that provinces, the federal government, municipalities need to be paying attention to in terms of the outbreak. Another thing, though, Rosie, that I did want to seize on from what the Prime Minister just said, we haven't discussed it yet, but I think if it is not of great significance at this moment, we should certainly keep an eye on this issue going forward. Our colleague Ashley Burke asked about this essentially fundraising drive by the European Union to raise more money for the WHO, and the Prime Minister did say in his answer that it is something that Canada is looking to participate in. I think this is significant. it's going to be significant if indeed Canada does put forward additional funding for the WHO. We know that this has been a real point of contention and concern. I believe we can see Minister Miller there, so maybe we better talk a bit more about that after this briefing.
Yeah, but a good point. Thank you for bringing it up. All right, here is the Minister of Indigenous Services, Mark Miller, and we'll bring that to you live right now.
The Minister from Nova Scotia has been through a lot, and indeed all of Canada has been through a lot, but in particular I want to thank her for being here because in particular she is grieving, but we are all grieving, and we're all here with you, Bernadette. So I do want to thank you for being here. But again, our hearts are still heavy given what has gone on in Nova Scotia over the past week, so thank you. I think we'll get right to it. Dr. Tam will speak first, followed by Dr. New, followed by myself, and then Dr. Wong, and then Minister Jordan.
Hello, everyone, and bonjour à toutes et à tous. I'll just start with the usual update on the numbers of COVID-19 in Canada. There are now 44,364 confirmed cases, including 2,350 deaths. To date, labs across Canada have tested almost 670,000 people, with about 7% of these testing positive. Today marks the start of National Immunization Awareness Week. As we're now in the midst of a global infectious disease pandemic, I cannot imagine a more poignant time to talk about the benefits of immunization. As we reflect on the importance of vaccination this week, I'd like to highlight an unsung hero of vaccinology, Dr. Maurice Hillman, whose career is an inspiring outline of our modern vaccine era. Dr. Hillman was a virologist and vaccine scientist who helped to develop 9 of the 14 vaccines that are routinely recommended for children today. Vaccines that prevent measles, mumps, rubella, chickenpox, meningitis, Haemophilus influenzae, and other infectious diseases. Known for his focus on safety and reducing vaccine adverse events, Dr. Hillman was also the original vaccine fast tracker, owning to his mastery of the science of vaccines and the myriad processes from research through federal regulation and delivery. It was this unique ability that enabled him to develop and fast-track a 1957 pandemic influenza vaccine, preventing untold illness and deaths that winter. With the COVID-19 pandemic still in high force, there is an urgent need for this accelerated process, focused on delivering a safe and effective vaccine, and the world is responding in equal force, with 20 institutions and companies working on expedited vaccine development, while over 70 countries are working collectively to accelerate research on treatments. But there is one more lesson from Dr. Hillman that we must heed today. Though a hero who saved hundreds of thousands of lives with a pandemic vaccine, he never lost sight of the millions of lives that could be saved with routine vaccination programs for existing infectious diseases. For that, he is credited with saving millions of lives, more than any other scientist in the 20th century. This brings me to my key message today. We are in a pandemic, and we have all committed to protect ourselves and our families with physical distancing, to stick to essential activities only. So my message is that vaccination is an essential activity. It is normal to feel concerned about visiting a doctor's office or a clinic at this time, but please know that healthcare providers have precautions in place to prevent the spread of infection, like screening patients before appointments and staggering patient times to maintain social distancing. Contact your healthcare provider to find out ways to safely make sure that your family's vaccinations are kept up to date. This is a life-saving, essential must-do. Thank you.
Thank you, Dr. Tam. Dr. New.
Bonjour. Good afternoon. I'll start with the latest numbers on COVID-19 in Canada. There are now 44,364 confirmed cases, including 2,350 deaths. To date, labs across Canada have tested almost 670,000 people, with about 7% of these testing positive. Today marks the start of the National Immunization Awareness Week. As we are now in the midst of a global infectious disease pandemic, I cannot imagine a more poignant time to talk about the benefits of immunization. As we reflect on the importance of vaccination this week, I'd like to highlight an unsung hero of vaccinology, Dr. Maurice Hilleman, whose career is an inspiring outline of our modern vaccine era. Dr. Hilleman was a virologist and vaccine scientist who helped to develop 9 of the 14 vaccines that are routinely recommended for children today. Vaccines that prevent measles, mumps, rubella, chickenpox, meningitis, Haemophilus influenza, and other infectious diseases. Known for his focus on safety and reducing vaccine adverse events, Dr. Hilleman was also the original vaccine fast tracker. This, owing to his mastery of the science of vaccines and the myriad processes from research through federal regulation and delivery. It was this unique ability that enabled him to develop and fast-track a 1957 pandemic influenza vaccine, preventing untold illness as well as deaths that winter. With the COVID-19 pandemic still in high force, there is an urgent need for this accelerated process focused on delivering a safe, effective vaccine, and the world is responding in equal force with 20 institutions and companies that are currently working on expedited vaccine development, whilst over 70 countries are working collectively to accelerate research on treatments. However, there is one more lesson from Dr. Hilleman that we must heed today. Though a hero who saved hundreds of thousands of lives with a pandemic vaccine, Dr. Hilleman never lost sight of the millions of lives that could be saved with routine vaccine programs for existing infectious diseases. For that, he is credited with saving millions of lives, more than any other scientist in the 20th century. This brings me to our key message today. We are in amidst a pandemic, and we have all committed to protect ourselves and our families through physical distancing, to stick to essential activities only. So, my message and our message today is that vaccination is an essential activity. It is normal to feel concerned about visiting a doctor's office or clinic at this time, but please know that healthcare providers have precautions in place in order to prevent the spread of infection, such as screening patients before appointments and staggering patients' times to maintain social distancing. Please contact your healthcare provider to find out ways to safely make sure that your family's vaccinations are kept up to date. This is a life-saving essential, a must-do. Thank you.
Merci, Dr. New.
Thank you, Dr. New.
Good afternoon. This week, we have seen an increase in the case counts in First Nations communities. As of April 24th, there have been 95 confirmed cases of COVID-19 in First Nations communities on reserve and 14 confirmed cases in Nunavut's Inuit communities. Si le nombre de cas reste relativement faible dans les communautés autochtones à ce jour,
the number of cases are low in Indigenous communities, but we're following this whole pandemic closely. We're working with public health authorities and local authorities to do what we can to make sure that these communities have all they need. We also work closely with communities throughout the country to make sure that they are always ready to face an increase in the number of cases.
The security can lead to devastating results. There are a number of immediate actions that can be taken that have proven to be the most effective means of slowing the spread of the virus. Ones many of us have become quite familiar with, but which are worth repeating, namely hand washing, physical distancing, no large or even small gatherings, self-isolation, and active identification of symptoms. We count on Indigenous leadership to persist in their efforts to share this message with their communities. To date, we have distributed, in addition to supplies provided by provinces and territories, 160,000 gowns, 500,000 gloves, and close to 200,000 surgical masks in communities. We also saw positive progress today in terms of our support for urban Indigenous populations. This week, 94 programs were supported through the Indigenous Community Support Fund. These programs support a variety of Indigenous measures that help youth, homeless individuals, and elders by providing food baskets, childcare, mental health supports in urban settings principally. We're proud to be supporting, among other, the Friendship Centres as they continue their important work for vulnerable urban Indigenous communities in the face of this pandemic. We are also working quickly to get the funds out of the door for the 94 accepted submissions, and we have streamlined the process so that funds can flow directly to Indigenous communities and groups across the country in very short order. We recognize that more support is needed. And as I've said before, this should only be viewed as the start of our support for urban Indigenous populations in particular.
This week, the Prime Minister announced $9 billion for post-secondary students, as well as a one-time increase of $75.2 million to support students in a post-secondary setting, to support Indigenous students as well.
You may be worried about your future, whether it's your financial situation, your employability, or the continuity of your studies. And I want you to know that as you face unique challenges in addressing COVID-19, we will make sure that you have the financial assistance that you need when you need it. This new funding is over and above the base funding each Indigenous distinctions-based program receives to support post-secondary education and will cover costs such as support for living, travel, counseling, and other support expenses to ensure the success of Indigenous students. This funding is also over and above the measures announced by the Prime Minister this week. Indigenous students can access all of the other student supports that fall within the larger COVID-19 economic response plan for post-secondary students, including the Canada Emergency Student Benefit, the new Canada Student Service Grant, and the Enhanced Canada Student Loans Program. Je tiens également à saluer.
I would also like to commend the Canadian Armed Forces Rangers in Nunavut, in the Lower North Shore, in Itashquan, as well as in other regions that support their local communities by distributing food, by helping with medical equipment, and by raising awareness to help health services and communities to fight against the COVID-19.
Between the government, public health departments, provinces, territories, Indigenous leaders, elders, and community members, we are all focused on the public health response that will save lives. Miigwech, Nakumik, Marcy, thank you. Merci.
Dr. Wong. Thank you. I would like to acknowledge that we are on the traditional and unceded territories of the Algonquin people. Il y a plusieurs façons de rester en bonne santé. Cela comprend.
There are many ways to stay healthy. For example, not traveling
is the best way to contain the spread of COVID-19 by keeping at least 2 arms length away from other people. As well, no gatherings or group outings and limiting contact with people at high risk, such as elders and those in poor health. However, I encourage immunization, physical exercise, and getting onto the land. Individual harvesting and fishing are excellent ways to connect with culture and support your mental health while respecting physical distancing. Nakumik, merci, miigwech, merci, et thank you.
Merci, Dr. Wong. Et maintenant, je passe la parole.
Thank you, Dr. Wong. Now, Minister Jordan.
Thank you. Good afternoon. Bonjour. Kwai. Before I begin, I would like to just take a moment to thank Canadians from coast to coast to coast who have been so wonderfully supporting of Nova Scotia. This past week has been very difficult for us, but your love, support, and condolences have meant a great deal to all of us, so thank you for that. The women and the men who work in Canada's fish and seafood sector are the economic drivers for many of our coastal and rural communities. They've been feeding Canadians for generations, and we need them to continue to do that in these very challenging times. When the industry is strong, everyone does well. But when it hurts, we all hurt. Lorsque l'industrie est forte, tout le monde se porte.
When the industry is strong, everyone does well. And when it hurts, we all hurt.
We've been in constant contact with harvesters and processors to understand what they need for a safe, strong season. One of the things we've heard are real concerns about the ability to move product from both storage capacity and a market perspective. Without the ability to move goods efficiently and effectively, processors can't buy more from our harvesters, and in turn, they can't supply Canadians with seafood. Bolstering our processing sector will be vital to supporting the fish harvesters and feeding Canadians this season. So today we're announcing $62.5 million for the new Canadian Seafood Stabilization Fund, which will go directly to the fish and seafood processing sector. This funding will support the industry as they increase cold storage and inventory capacity, allowing them to process more from harvesters and feed more people. Retool their technologies and marketing efforts to meet the shifts in consumer demands and create value-added products, and put in place enhanced health and safety measures to minimize risk to workers, among other things. We've always said we would adapt our measures as this situation progresses to tackle new challenges head-on, and that hasn't changed. We know this is a difficult time, but our government will be here every step of the way as we weather this storm together. We're actively exploring other ways to support harvesters and the industries as we move forward. But today's announcement will provide immediate support to the industry, help ensure access to this important food source, and help position the sector to return at full strength once the pandemic is over. The industry has faced tough times before, but the people who work in our fish and seafood sector are determined and resilient, and I have full confidence that we will get through these hard times too. Thank you. Merci. Walalin.
Merci, Madame la Ministre. Et maintenant, nous sommes impatients.
Thank you, Minister. And now we will move on to questions and answers.
As usual, we'll start with 3 questions on the phone, 1 question, 1 follow-up. Operator.
Thank you. Merci. Once again, please press star 1 on your telephone keypad at this time to ask a question. Veuillez appuyer sur étoile 1 maintenant pour poser une question. Our first question, notre première question, nous vient de Catherine Lévesque avec la presse canadienne. Please go ahead. Your line is now open.
Oui, bonjour à tous.
Good afternoon, everyone. My first question is for Dr. New. I would like to hear what your position is with regards to immunity passports that have been talked about in recent days. The WHO has said that there is no evidence that those who have had COVID-19 are now immune to it. What is your position on that matter? We have to study this idea of creating immunity passports. Answer. Thank you for your question. The COVID-19 virus is a new one, and so we are still learning. There is a very steep learning curve through science that constantly progresses. Up to now, with what we've seen abroad and what we've seen with data that we have analyzed, we have noted that people who have already been infected with COVID-19 that have created antibodies, but what is not clear up to now is whether these antibodies mean immunity and for how long. There is no evidence up to now that having been infected leads to long-term immunity, and so we're not ready to say that if someone has already contracted COVID-19, everything's perfectly fine, no more malarkey, just immunity for life. This is something to follow up on, and we will continue to examine what science and evidence shows us with regards to this. Thank you, Dr. New. My next question, I don't know if you have an answer, Mr. Miller. Perhaps yesterday I asked a question to Ms. Freeland. Where are we with Ontario and Quebec's request to have military personnel in long-term and senior care homes. Do you have any news on that front? You perhaps heard the Prime Minister's press conference. Currently, we have sent in Army medics in reconnaissance to figure out what is required. Over the next few days, we will study the matter closely and potentially re-evaluate current demands. Such a process is already underway. Armed force personnel and medics will be deployed in Quebec for this initial reconnaissance.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Teresa Wright with the Canadian Press. Please go ahead. À vous la parole.
Good morning. I'd like to ask Minister Jordan about the announcement today. It was specifically focused on fish processors, but fish harvesters, including lobster fishers in the Maritimes, are grappling with the decision about whether to set their traps and incur the considerable costs when it comes to that, with no financial package specifically aimed at them. Is there help coming for fish harvesters, and specifically, will the wage subsidy be extended to lobster fishers for their spring season?
Thanks for the question. Absolutely. The message today is for the processors. The announcement today was to address concerns that we've heard from the processing sector, but we also recognize that in order for the harvesters to continue to fish, they have to be able to sell their product. That's one of the reasons why the processors are the people that are first out the door. We are actively exploring other measures that will definitely impact other sectors, other areas in the sector. We know it's important to listen to harvesters. We know that there has been some challenges with them actually accessing the funds that have already been announced. We're continuing to look at all of these things that need to be done, and we'll be continuing to follow up with new measures as we go forward.
Teresa, follow-up?
Yes, thank you. Minister Miller, several First Nations in Canada were dealing with suicide crises before this pandemic started, and we know that COVID-19 is only going to have a compound mental health impacts on many First Nations, Inuit, and Métis persons who are suffering from, intergenerational trauma caused by colonialism. Why are mental health resources not a bigger part of the pandemic response, especially for Indigenous communities?
Teresa, as we follow the evolution and the impact of the epidemic, particularly in the portfolios that I am responsible for, we know that the impact on Indigenous communities is high on many fronts, including the impact on mental health, a component of which is suicide. Our teams are working actively with communities to increase the capacity and support for people that are suffering. This is something that will evolve over time as communities implement the health directives, make sure that they are looking in on each other and that we are supporting them in a comprehensive way that we need to do. As you mentioned pertinently, COVID-19 has a compounding effect on all the pre-existing conditions that Indigenous communities are subject to. That is a wide generalization because these preconditions vary from community to community, but on the whole, the social determinants of health create conditions where COVID can run rampant, has that potential to run rampant. The apprehension and fear that exists within the communities is real, and that has an impact on mental health. We, as part of Indigenous Services Canada, a large amount of the support that we provide turns in and around supports around mental health. Those continue, but as this epidemic and all the impact that it can have, particularly on the well-being of people's, is assessed and continually reassessed, we'll stand ready to provide that support. I'd ask actually Dr. Wong to add a few words.
We work with Indigenous partners to ramp up the implementation of First Nations mental wellness continuum framework, as well as the national Inuit suicide prevention strategies. Those are Indigenous-led efforts, and we are fully behind supporting those efforts during these very trying times.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Mélanie Marquis avec La Presse. Please go ahead. À vous la parole.
Merci beaucoup.
Thank you.
Good afternoon. My question is for Dr. Tam. How worried are you about an anti-vaxxer movement in Canada when it comes to the eventual COVID-19 vaccine? Is your department tracking groups, watching social media to prepare to such possibility?
So as I've said, there's a global effort in the discovery and the research on looking at safe and effective vaccines for COVID-19. So that is not a reality as yet, and we think it would take some time. But as a whole, what we want to do is to make sure we get the information out to parents and to Canadians about the safety and effectiveness of vaccine as a key component of keeping people healthy in Canada. And we are not immune to the incursions of very contagious pathogens like measles, for instance. So that is something that globally we are quite concerned about after people are coming out of their homes in more less sort of physical distancing would potentially mean that there could be outbreaks. And so this is why we're asking people to set up appointments, find out how you can get vaccinated even during this time, because it's an essential service. I think, in terms of looking at people who have questions about vaccination, we're there to answer the questions based on the scientific facts. I think prior to this particular pandemic, I've been working quite hard with not just the medical community or pediatricians, but also with parents and parent influencers, as well as social media platforms, to look at how we can address the disinformation and misinformation about vaccinations. So that will continue.
Mélanie, en suivi?
Oui, merci, Carl. So just to make sure, Dr. Tam, are there any indications that such combat will be necessary to fight against misinformation, and also Mr. Trudeau addressed the need for a national plan today about reopening the economy. Do you think we should, since the situation is different from one province to another, would you recommend that we close or we shut down inter-provincial travel?
So just to finish off the first question, I think, is that we won't really know much about the vaccines until they've been further developed. And we do need to ensure safety and effectiveness. So I think the key is to communicate those facts. I can't predict what is going to happen in terms of the uptake for the public, but we will definitely, like in all immunization programs, take public education and awareness into account. It's difficult to say, actually, because in our experience, even in the middle of a pandemic, like the pandemic of influenza, you can't really tell. Sometimes it's quite an emotional reaction. I recall in the last pandemic, when you get an increase in deaths, for example, people will suddenly want to take up the vaccine very, very fast when you don't actually maybe have enough to go around as the vaccination programs are rolled out. So those dynamics we can't actually comment on at the moment, but it's something that we're aware of.
And I just would add that as we, as a society, face a number of challenges over the years with respect to complacency and how vaccines are are regarded. This is also an opportunity to combat that disinformation with awareness as to what the importance of vaccines are, and as we see our elders and people in long-term care facilities exceedingly vulnerable and dying in indignity, this is also an opportunity to reinforce the point and the importance generally of vaccines. And when you talk about Indigenous communities, there is sometimes a legitimate skepticism with the way the medical services have been provided in the past, and various access to medical services, but also the way it is regarded. And so that is an additional hurdle. We're always fighting disinformation, but this is also an opportunity to raise awareness as to the importance of vaccines.
Thank you, Minister. Ashley?
Sorry, in terms of the second question, I think we are working very closely with all chief medical officers to look at the conditions upon which some easing of the public health measures should be taken. So that, I think, it forms the foundation of some of the decision-making on what needs to be done. I think each community has very different needs. For example, we heard about some cases in northern Saskatchewan, and that means protecting those communities are very important. And so even within a province, so those decisions are taken at a very sort of local and provincial level as well to protect those communities. And so, but we need the foundational public health approach, and then there needs to be some flexibility in terms of protecting communities on the ground.
Good morning, Dr. Tam Ashleyberg, CBC News. I'm hoping you can expand on what Dr. New said about immunity passports and certificates. Could it be effective?
So I think the answer is we don't actually know yet. I think just this last few days we talked about the immunity task force, and some of the objectives of that task force is to conduct the necessary research in order to help us interpret what serological testing results mean. So by that, I said it is a very novel virus. We actually don't understand the immunology of this virus very much. We got some idea now about some of the antibody response, and some of these responses are quite delayed. We don't know when the sort of peak of the antibody response might be reached. We definitely don't know how long the antibody response might last for, and what it means if someone gets reinfected. So all of those are unknown. The other unknown right now is also the performance of some of the tests, and that's partly related to the understanding of immunology, but each test performs differently. And so our National Microbiology Lab, having evaluated a range of tests, shows that a lot of them are not sensitive or specific enough, which means you could, in fact, get false positives where someone thinks they may have antibodies and they don't, or the lack of, false negatives as well, and specificity. So those are sort of evolving knowledge. And so I think from our perspective, if you had a test, what we need to do is do these studies so that you know how to interpret that test. So I do think it's premature to sort of think about the concept of a passport.
I'm hoping you can talk about herd immunity. Quebec's premier has said that allowing a large number of non-vulnerable people to get the virus naturally in Quebec would be the best defense against a second wave that could be potentially worse and even overwhelm the hospital system there. Do you recommend this approach to provinces and territories? Could it be the new normal?
I think part of the immunity task force is also to have a look at what the level of immunity is in our Canadian population. We actually don't know that, and I think, as we all appreciate, the number of reported cases is an underestimate of the number of people that have got the infection. So I think that is the first step. I think given the incredible public health response and the response of Canadians to do the physical distancing, it is possible that the level of immunity is quite low. And what I do know is that while this particular virus can have a very devastating impact on seniors, our elders, and those with underlying medical conditions, it can actually result in quite severe outcomes, even for the young and for the rest of the population. So, the idea of sort of generating natural immunity is actually something that is not something that I think should be undertaken. I personally think that, we, as the chief medical officers, we would, really be extremely cautious about that kind of approach. You never know if you, even as a young person, might get severely sick or get into the ICU. So it's not a concept that should be supported.
Rachel Haynes from CTV National News. My question is for Dr. Tam. We're talking a lot about the science behind antibodies, but we also know that a vaccine is what will help us return to the new normal, as the Prime Minister has said. How confident are you that a vaccine will actually be effective in combating the spread of this disease?
I think the honest answer is we actually don't know at the moment at all. I think that there are some promising candidates that are in very early development. And because we don't understand the immunology of the virus enough, it is a very premature, thing to even try to comment on, whether we'll actually get a vaccine. And then if we do get one, then how effective it is. The other thing that we don't know about is the evolution of this virus. What would this virus be like in another year? And how would that affect the effect of the vaccines are all unknowns. But what I am heartened about is the amount of research that is going into this at the moment.
And given that it's too premature to even be talking about the effectiveness of it, the Prime Minister has said multiple times over the last few weeks that we will only return to normal if we get this vaccine. But today we're talking a lot about reopening the economy. So is it premature to even be at that step right now when the science is so unclear at the moment?
Well, I think what is really important is absolutely focus on eliminating this first wave. That is really, really critical, and be very, very cautious about it. All of these outbreaks in these high-risk settings must be addressed. There must be plans to prevent further infections in long-term care homes, in acute care settings, in the sort of crowded living conditions. That actually has to be in place, as well as the testing strategies, increasing the number of tests. So there's a number of conditions upon which I think we can cautiously move to what I would call a new normal. So we're trying to balance very carefully the public health measures against disease activity. The moment that we're going to see some uptake in disease activity, you're going to have to be able to react to that and rapidly contain any of these outbreaks. So I think as we've observed, the epidemiology is quite different across the country. So there will be some differences in the timing, but tread really, really cautiously, because I think that the chains of transmission will be reignited very rapidly should we don't take absolutely great care as we come down that slope on the other side of the epidemic curve.
Merci, Dr. Tam. On va retourner au téléphone pour 3 questions. Opérateur.
Thank you. Merci. Our next question, notre prochaine question, is from Savannah Aubie from Brunswick News. Please go ahead. À vous la parole.
Hi there. My question is for Minister Jordan. We're hearing concerns here in New Brunswick about the federal government bringing in 150 temporary foreign workers to help work in Shediac lobster fisheries. I'm wondering when these workers are expected to arrive in the province, and have you received pushback in trying to bring these workers in to support the sector?
We've heard from the sector how important it is to have the temporary foreign workers. One of the big concerns we're hearing from processors is their ability to have a secure labor force. That's one of the reasons why we made temporary foreign workers people who are able to come into Canada. They do have to follow all of the public health guidelines with self-isolation once they arrive. That's critical. But we know that it's extremely important that we have that labor source in order to keep the food supply chain open. That's one of the reasons that we've allowed this to happen. It's extremely important in agriculture and the fish and seafood sector.
Okay, and thank you. I'm wondering, on the aid announced today, when can seafood processors expect to receive the funding, I guess, in their accounts to get started on introducing these measures? And what criteria will they have to meet in order to qualify?
So the funding is actually going to flow through the regional development agencies. In Atlantic Canada, it'll be ACOA. In Quebec, it'll be DEC. And on the West Coast, it'll be Western Diversification. We are looking at now the ways that it's able to get it out the door as quickly as possible, because we know how important this is for our processors to have these funds. Today's announcement will actually provide provide stabilization for them so that they know it's there, they know that they can access it. Many of them have ongoing relationships with our regional development agencies, so we felt that this was the quickest and easiest way for them to access the funds.
Thank you.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Philippe Vincent Foisy avec Radio-Canada. Please go ahead. Your line is now open.
Oui, bonjour. La question est pour Monsieur Nou.
Good afternoon. Dr. Nou. When we'll start to reopen the economy, what will this look like in businesses and hair salons, for example? With regards to PPE, will everyone have to wear gloves, wear face masks? What will PPE look like during this reopening of the economy? Answer. Thank you for the question. Dr. Tam and I are having fruitful discussions with our provincial and territorial counterparts. We are talking about guidelines and criteria that would allow us to loosen public health measures. For example, one such principle could be, in one region, in one community, has community transmission been stemmed? We need the capacity to screen our population. The healthcare system must also be healthy and well-equipped to follow up contact and to manage people in hospitals. There's a whole range of criteria. There are signs that show us that cases have been well controlled. With a lot of wariness, we may be able to loosen certain public health guidelines for outdoor activities, for example, gradually, based on where each province is with regards to their epidemic curve. These provinces could allow people to, for example, go outside, to go for a nice walk in the park, for example, whilst socially distancing, of course. We are currently discussing the matter. We can't give you any details as of yet, as this is an ongoing discussion we're having. This is an evidence and data-based approach, and so we may have some information for you over the next few days or weeks. This is a continuous conversation for today and tomorrow. Minister Miller, answer. It would be irresponsible to talk about reopening the economy. Dr. Tam spoke about the first wave, which means that there could be a second one. Some countries have succeeded well so far with regard to their first wave. They reopened slightly too quickly. That's the risk. We will have to examine data and evidence. We'll have to base ourselves diligently on science. We'll have to study the epidemiological curves in various provinces, various territories, in indigenous communities. Also, different strategies could be done on a tailored approach. Speculating on deconfining our country would be irresponsible, because this has to be a continuous and constant evaluation. It must be based on mass screening, which has not been done at the moment. Blood tests also have to be done in the next few months. All this information will then feed into our dialogue on deconfining the country, and this, so long as we haven't developed or deployed a vaccine. Second question. I'll try to ask a more simple question. My question had to do with PPE, and you said nothing on the matter. Is there enough stock to protect everyone? Or will there be when we'll start to reopen the economy? You keep saying that we're not ready, we don't have enough, but provinces are ready to reopen. Do we have enough stock to protect people? Dr. New, in French, could you talk about collective immunity? Dr. Tam spoke about it. But could you talk to us about it in French? Is community immunity tangible? Is it abstract? Because we don't have data on it yet. Answer, Dr. New. When it comes to PPE, we've already highlighted the fact that there is a difference between medical-grade masks and others. N95s are essential for healthcare workers and essential workers on trains, for example. With regards to the general population, perhaps it could be a good idea for people who are slightly symptomatic, if they are unable to keep a 2-meter social distance, for example, in public transit or at the grocery store, perhaps they could wear a non-medical grade mask. And so I believe, and I've seen it myself online, there's a whole range of non-medical masks that are available to buy with instructions, and even on our own website we have instructions to build your own homemade masks made out of various materials. You have to make sure that water droplets cannot go through these masks. We must also highlight the fact that if we have a non-medical grade mask, it's not to protect ourselves from others. It's another way for us to protect others from ourselves. If, for example, we are slightly symptomatic, if you're coughing, for example, it's to protect others from you.
Thank you, Doctor. And that's all the questions we had for today. Ceci met fin à la conférence de presse. Merci.
Okay, and that is our federal briefing from both cabinet ministers and public health officials today. The focus a little bit on the announcement that the Prime Minister made earlier about some support for fish and seafood processing. Also some questions about whether more would be forthcoming for fish harvesters, and the answer basically was yes, indeed, that is the case. But the vast majority of the questions really about how we move forward, and that is really where the focus of much of the country is right now, although on very different timetable. I'll bring in the CBC's Catherine Cullen. She's been helping us with her coverage through the morning. Lots of questions, and I'll let you talk about it there, Catherine, around herd immunity. And I thought Dr. Tam was pretty definitive in her assessment of that so far.
Yeah, I mean, we certainly have seen a few points of, I'll call them contention, Rosemary, between the federal government and what is happening in Quebec. And this, in terms of the advice from medical experts, is certainly going to be one of them, because we've heard Quebec Premier François Legault and Dr. Horacio Arruda, the Chief Public Health Officer in that province, talking about the concept of herd immunity when it comes to young children, that as Quebec looks at gradually bringing children back to school, and the idea would be, of course, not to do it all at once, that they would hope, officials have said, to build up herd immunity so that the population could eventually be broadly immune to COVID-19. And we heard Theresa Tam saying there very clearly, they don't support that idea. The science is not there yet. This also feeds into the question we've been talking about today of this issue of immunity passports, something that Chile, for example, is looking at. A lot of people might think, well, if you've had COVID-19, you are immune. We're hearing from the World Health Organization. We're hearing from Dr. Tam today. The science is not there yet. They do not know what happens in terms of a number of issues. Yes, you develop antibodies after you've had COVID-19, but when do they peak? What happens if you get the disease again? We heard Dr. Tam talking about a host of issues having to do with what happens if the virus were to, for instance, mutate. But she did say very quickly, when it comes to the concept of herd immunity, the idea of generating natural immunity is not something that should be undertaken. So I think that's going to provoke some very interesting questions in Quebec. Certainly, we will be interested to see how officials in that province respond. And I think it's also probably important to mention one of the things that officials mentioned up top, which was the question of vaccination broadly. There are some interesting things to reflect on in terms of what she said about a vaccine for COVID-19 and the number of questions around when will one be developed, the challenges with this disease. She was quite blunt about the fact that it's really not something they understand very well. These are really the early stages. She did say she sees some signs of hope when it comes to the number, like essentially the size of the effort here, the number of studies being undertaken, the amount of research being done in order to try to find a vaccine. But officials making the point today that there are, of course, other diseases out there, and because people are staying home, they don't want them to stop going out and particularly getting their children immunized. Dr. New said it is a must-do. You must continue to vaccinate your children.
Yeah, and particularly we know that in the United States they've warned against the double hit of a potential second wave of COVID-19 and then the regular flu, the seasonal flu. And so the idea that you need to be vaccinated against the seasonal flu as well as we await how this virus can mutate. Catherine, thank you very much for all your great coverage today. Appreciate it very much. CBC's Catherine Cullen. We will leave it here on CBC News Network. Just a reminder that the Prime Minister and officials are going to take a break from daily briefings tomorrow. I happen to have it on fairly good authority. They'll be back on Monday, and so will I. For now, though, our coverage continues now with Michael Serapio on CBC News Network. Michael.
Well, thank you for that, Rosemary. Rosemary Barton in Ottawa. Well, let's say that we're going to get back to our COVID-19 coverage a little later in the program, but right now let's turn our attentions to Nova Scotia because police in the province continue to investigate right now last weekend's deadly mass shooting, and we certainly have learned a lot since then about the 22 victims. And just yesterday, Nova Scotia RCMP shared new details about